Hi, I am Apurv Sinha, consultant trauma and orthopedic surgeon with special interest in hand, wrist and shoulder and elbow surgery. In today's video, we are going to discuss about trigger finger. Trigger finger is caused by problems in the tendons of the hand, which can involve fingers as well as the thumb. Tendons are structures which attach muscles to the bone and help move the joint. Tendons are present in our hand both on the flexor aspect and also the dorsal aspect of the hand. The tendons on the flexor aspect are called the flexor tendons, and these help to bend the fingers. These flexor tendons run in special channels which are also called pulleys. These pulleys hold the tendons in their position. If the tendon becomes very thick and inflamed, or if the pulley itself becomes thickened and contracted, the tendon can start catching within the pulley and get stuck in it. On some occasions, there can be small nodules which can form within the tendon, making it thicker than normal. In this case, the movement of the finger will not be smooth and the finger will start catching and locking, giving the typical triggering. In this video, we can see clearly that when the patient bends his finger, it gets locked in one position and then he has to physically pull it straight to unlock the finger. This is typical trigger finger. We do not always know what causes trigger finger, but there are various diseases which can be associated with triggering of the finger. A list of this is shown in the next slide. Treatment options for trigger finger include simple measures like anti-inflammatory medication, rest, simple exercises, moving on to splintage of the finger. For mild to moderate disease, steroid injection can also be tried. For severe cases where there are daily frequent symptoms, locking of the finger which is very painful, and a permanently locked finger, surgical intervention is required. Surgery for trigger finger is usually done as a day case procedure under local anesthetic. The local anesthetic injection is given in the middle of the palm along the length of the finger which is being operated on. The initial injection can be a little bit uncomfortable and painful, but then it becomes numb. A very small incision is made just on top of the pulley which is to be released. Once the skin is opened, the pulley is identified and it's released, making the finger free. The tendon can then glide without getting caught in the affected pulley, and the skin is then closed. Following the procedure, it's very important to look after your hand. In the first few days, it's important to keep the arm elevated so that the swelling stays down. It's also important to keep the fingers mobile so that the fingers don't get stiff. In few days' time, it's advised that you see your practice nurse or your district nurse to check the wounds to make sure they are healing. The stitches are removed at about 10 to 14 days' time, and then once the wound has settled, simple activities can be undertaken. A return to full manual work can take up to 4 to 6 weeks, and it depends a lot on what job you perform. As with any other procedure, there are some risks associated with trigger finger release as well. These are shown in the next slide. The common problems which can occur are bleeding, infection, scar tissue formation which can be uncomfortable, complex regional pain syndrome which is hand becoming very painful and stiff after surgery, small risk of damage to the nerves and vessels which run very close to the tendon, very small possibility of recurrence of the disease. If you require any further information about the disease, please visit our website, and you can also ask any questions that you have when you come and see us in clinic. Thank you.